Hello, my name is Kyle Longton. I'm the Chief Operating Officer of the American Foreign Service Protective Association, and it's my pleasure to welcome you to the 2021 AFSPA annual meeting. This is our first planned all virtual meeting, and we have record RSVP, so I'm hoping for record attendance today. We've got a great program planned, but before we get into any of that, I'd like to take some time to take care of housekeeping items. I won't be pointing out, as I have at past meetings, where the fire exits are and things like that, but I do want to give you a couple notes about our virtual platform today. We chose the Zoom platform because many people at this point are familiar and comfortable with Zoom, but this is a Zoom webinar and not a Zoom meeting, so it may be a little different from your past experiences using Zoom. First of all, your Zoom app, your camera, your mobile device are not broken. Do not attempt to adjust them. We have disabled video for attendees. We've also disabled the chat and the live question and answer feature. So please don't worry about that. We are here and we have questions that you've submitted. We'll talk more about that in just a minute. If you have any trouble with the audio, there is an option for closed captioning. If you're using the desktop version, you should find that at the bottom of your screen along with the other options. And as well, you can turn that off in the same place if it is in any way distracting to you. If you're using the mobile device, you will likely have to go into your mobile device settings, turn off or enable the closed captioning, and then re-enter the meeting. If you have any technical issues, I encourage you to visit support.zoom.us to address any of those or seek the frequently asked questions that appear on that site. As I mentioned before, due to time constraints and the virtual format, we're not taking any live questions. However, when you registered, you did have the option to submit questions at that time, and we received 150 questions. So thank you very much for your interest in the event and for sending those ahead of time. You will be receiving a response to your question if you have not already received one from either myself or one of my colleagues. We will have some time at the end of today to answer some of those specific questions and dive a little bit deeper into some of the topics that came up most frequently in the messages that you submitted. You should not see a raise hand feature at the bottom of your screen. However, if you do, please know that we will not be attending to those. We'll likely just take action to lower your hand due to the time constraints for today. I want to take a moment and also point out that we do have a resource page and virtual packet that were shared with you in the email and that now appear on your screen. So please visit those. We've taken time to work with our partners to get more information and in many cases to get videos that describe the various programs, some of which we'll talk about today, some of which we won't have time to. So delve in deeper. It'll be available not only today, but throughout the rest of the year. So you can return to that, refer to it and get more information. You can also use the virtual packet. You can see the URL for that as well to go and access our official brochures, our official information to learn more about programs and opportunities to learn more that we will discuss today. Throughout today, with our various presentations as well as our keynote speaker and some of the demonstrations, you'll hear more about our 2021 theme, which is mental wellness leads to better physical health. If you're thinking this sounds familiar, you're right. It was also our theme in 2020. However, the stats and the anecdotes and the information we're receiving from you, our members, indicate that mental wellness and mental health are huge topics, not just for you, but for across the country and around the world. And we want to keep the focus on that and make sure you know what we have available to you to help you with your own needs. Before I get into the agenda for today, I'm going to ask our chairman, Tom Tracy, to share his thoughts with us. By way of introduction, if you've never met Mr. Tracy before, he is our chairman. He joined the U.S. Foreign Service in 1960 and served in Mexico, New York, London, and Washington. Between 1973 and 1979, he was the administrative officer at the American embassies in Brussels, Moscow, and Bonn. He then spent 5 years as Assistant Secretary of State for Administration, where he oversaw a budget that exceeded $500 million and focused on diplomatic security, building operations, communications, and IT. Following his time at State, he served for 15 years as the Chief of Administration of the Pan American Health Organization, or PAHO. Following his retirement from PAHO, he worked as a contractor back at the Department of State. In addition to his decades serving on AFSPA's board, Mr. Tracy is a member of the Board of Directors and Secretary-Treasurer of the Senior Living Foundation of the American Foreign Service. And you'll learn more about that organization later as well. Mr. Tracy received his Bachelor's of Arts in Political Science from Colgate University, his Master of Arts in History from Stanford University, and his MBA in Organization and Management from Columbia University. Mr. Tracy, please, what's on your mind today?
Good morning. I'm Tom Tracy, Chairman of the Board of the American Foreign Service Protective Association. On behalf of the board, the management, and the staff of the association, I'd like to welcome you to the annual members meeting. I'm sure all of us will remember the year 2020 for many years to come. The disruption, dislocation, the illness, and death will be seared in our memories for a long time. Fortunately, we seem to be on the verge of a new era as vaccines are beginning to roll out more quickly. As you can imagine, the pandemic had a very heavy effect on the work of the association. Within a matter of a few days, we had to go to a nearly 100% virtual operation. Fortunately, we had laid the foundation, IT foundations, to support this type of operation. And I think we have been successful in that process. Today, we have a group of interesting discussion topics. I hope you'll find them useful and informative. And I appreciate the time that you've taken to join us this morning, and hope that you will find it helpful.
Mr. Tracy, thank you very much. Thank you for spending a few minutes with us this morning and for that brief but enlightening review of last year and how the pandemic affected AFSPA. We're going to talk not only about a review of 2020 today, but also COVID-19. We're going to dive into how that affected AFSPA, AFSPA's members, as well as around the world, the changes that we're seeing, and the changes that we've implemented for our 2021 initiatives, not just for FSVP, but a little bit of what you may be seeing if you are perhaps a member of another plan. Our keynote today will be delivered by Dr. Charles Rosenfarb, focusing on mental wellness and the pandemic. And following his talk, we will also have some demonstrations of our online member engagement tools from some of our colleagues, not just at AFSPA, but also from Aetna and Express Scripts. So I hope you'll stay tuned for that. And we'll end the day with a little bit of question and answer, as I mentioned before, for some of those questions that were submitted. But I'd like to move on to the first part of our program, which is a discussion from Chief Executive and Executive Vice President Paula Jakub. Paula provides strategic leadership and facilitates the development and enhancements of various insurance and specialty programs offered by the Protective Association. She also serves as the Executive Director of the Senior Living Foundation of the American Foreign Service, where she provides proactive management to the vital organization devoted to helping the elderly Foreign Service community. In this critical leadership role, she oversees the grant and support functions and key activities that are vital to the continued success of the foundation. Ms. Jakub attended Creighton University in Omaha, Nebraska, before embarking on a more than 3-decade-long career in the insurance field. She received her underwriting certification from the American College and is a registered health underwriter, as designated by the National Association of Health Underwriters. In addition, she is formally recognized as a subject matter expert in federal health benefits by the Foreign Service Institute, where she serves on the adjunct faculty. She also serves on the board of the Association of Federal Health Organizations. Paula, would you like to start us off with a bit of review of last year?
Thank you very much, Kyle. And we are delighted to be here with you. And we are even more delighted that all of you are here as well. So I would like to start off with a review of open season. We miss seeing all of you, but are glad that we were able to find a way to reach you and to answer your questions. We actually held 15 team live events for our members all over the world in different time zones. We were able to participate in a virtual health fair that was sponsored by Long-Term Care Partners. And this offered us opportunities not only for daily responses to your questions, but also provided the opportunity for live chats with you. We participated in several multi-carrier virtual health fairs and also held presentations for the Department of State, Board of Directors of the Federal Education Association, and also in our strong partnership with AFSPA and DACOR. And we are very grateful to have those partners. This did yield some very positive results. We processed over 2,800 transactions during open season, and we are very pleased to welcome almost 1,400 new enrollees. So if you are a new enrollee, a very special welcome to you. And I hope that the Foreign Service Benefit Plan gives you everything we promised. This brings our total enrollment to over 35,000 enrollees. And every day, the Foreign Service Benefit Plan is responsible for the lives and welfare of over 87,000 members. Now, I'd like to go over a few statistics for our customer service. COVID-19, as Mr. Tracy said, created new challenges for us as we moved to telework almost overnight. But our AFSPA team remained passionate about member service. Our 2020 statistics for member services, we averaged an answer time on the phone of 20 seconds. Our emails were answered in an average of 3 business days, and we continue to strive every single day to provide you the excellent service to you that you deserve. A few statistics about our claims. The Foreign Service Benefit Plan paid over $371 million in claims, and the total number of claims were over 1.245 million, with almost 70% of those filed electronically. We had a 99.87% claims accuracy rate, and 93.2% of those claims were processed within 15 calendar days, and that includes those that required outside translations. We received over 125,000 calls, and our email correspondence was about 26,000, with an additional 14,000 handled by Aetna's secure email system. Our average response time was for that was around 3 business days as well. Turning to prescription medication, we hit a new record last year. We actually filled over 1 million different prescriptions, with over 522,000 of those being through the home delivery system. We paid almost $93 million in just prescription benefits alone, and the Protective Association paid about 90% of all of your prescription costs, one of the highest actually in the federal program. We're very pleased to offer such a generous prescription program. So let's talk about COVID. COVID hit each of us, either directly or indirectly. None of us could escape COVID. Over 1,700 of our members have tested positive for COVID-19. The highest incidence of that is in this local Virginia area, Maryland, DC, Florida, and in some of the AE addresses in Europe. We lost 24 of our members due to the COVID-19 virus. Majority of those were in the Washington metro region, and the rest were spread throughout the United States. So we mourn them and express our loss to their families. As far as the cost is concerned, the medical claims costs for COVID-19 last year was over $7.2 million. We received over 21,000 claims, most of which was in the laboratory arena, but that actually accounted for 2.5% of total medical costs for the Foreign Service Benefit Plan. One of the biggest features that we offered last year in direct response to the epidemic was our telemedicine and telehealth programs. Now, we already offer telehealth through Teladoc for our stateside members. In April of 2020, we did partner with vHealth to provide this service to our overseas members. And OPM did give us permission to offer telemed with your specific physician through a temporary emergency benefit. We paid almost $11 million for telemedicine and telehealth claims, and more than 21,000 members used this service in 2020, an increase of over 3,200%. No, that is not a typo. It's actually 3,200%. The use of telemedicine and telehealth for behavioral services really was notable throughout 2020. In fact, almost half, 46% of all of those telehealth visits were to seek behavioral health telemedicine support. We are very happy to be able to provide that benefit. Now, as far as the vaccine goes, vaccines, as you know, are ramping up, which is a very, very good news. And I just want to review how the Foreign Service Benefit Plan provides benefits for vaccines. All vaccines are covered at 100%. If you go to an in-network pharmacy or provider stateside, those will be covered at 100% and usually filed directly with the health plan. If you go to an out-of-network provider, we will still cover that at 100%. You may need to file your claim directly with us. If you are outside the United States, the Foreign Service Benefit Plan still will pay 100% of the bill charges. And just like you do with any other claim, you need to file it directly with us and make sure you indicate that this is from COVID-19 when you file your claim, so we can do that, so we can process that in a special way. I do want to spend a few minutes to talk about the actual impact of COVID on healthcare in general and the Federal Employees Health Benefits Program. Of course, I just reviewed the cost of testing to all the health plans. The cost of vaccines is actually now split between the government that is paying the ingredient cost and the plans that are paying for the administration costs. We will continue to pay for those costs. The cost of care is also a concern. It will run into the millions of dollars. And I actually think that this is just the tip of the iceberg from what we're seeing now, and that will continue. Now, the plans should have taken this potential into consideration when we did our 2021 and on to 2022 benefit structure. The Foreign Service Benefit Plan did indeed plan for this. Delayed treatment is also a concern for us, as many of you didn't go to the physician, or were afraid to go out, or your physicians weren't offering appointments, and you just stayed in and maybe did not seek treatment for that chronic or potential serious condition. Those will have effect on us, as now it may be more serious or a more chronic condition. But we're ready for that, and we will be there for you. Not to mention new technologies that really have nothing to do with the COVID epidemic, those specialty drugs that are coming on the market every day, the gene therapies that you hear about, and the immunotherapies that are definitely all breakthrough lifesaver treatments, but costly, many of which runs into the millions of dollars for just one dose. And all the plans must be ready for all of this. And if that isn't enough, mental health and mental wellness remains an issue for all of the plans, and a focus especially for the Foreign Service Benefit Plan. This leads us into the OPM initiatives, and the 2021 FEHB program goals are shared by the Foreign Service Benefit Plan and have been for years. OPM has chosen to put their initiatives around quality as it pertains to telehealth, improvement in measures for diabetes and high blood pressure, and also improving your access to care, where it is in the field of even behavioral health, opioid use, or pain management. Another main highlight is affordability, and providing price transparency is very important to OPM, as with the health plans. Surprise billing remains important, and these are the charges for out-of-network providers in in-network facilities. And I'll let you know what the health plans are doing, is specifically what Foreign Service Benefit Plan is doing, in a few minutes. Observation care also remains important with OPM and the health plans. And this is the short term outpatient hospital care where you may think you are admitted into the hospital overnight on an emergency basis. And in fact, you are in observation care and it's paid at a lower rate. But the plans are taking measures to help with that as well. And last, of course, but certainly not least, is prescription benefits. How do we provide those prescription benefits? How do we get those prescriptions to you in a timely, safe, and cost effective measure? Those specialty drug management that I talked about a little bit, whether it's payable for in the pharmacy arena or in the medical arena, and also that side of care. How do we get those benefits to you, those medications to you, and what is the best side of care for you? And of course, not to mention the gene therapy and the immunotherapy that are really new and up and coming benefits. Wellness, of course, needs to and does remain an important goal. Bringing healthcare closer is always a concern for us. It is one of our major themes, and I've already demonstrated the importance of telehealth, where you can actually see a primary care physician, specialist, or that all important behavior, mental, or emotional health. Smart healthcare devices also are important, where you actually have in-home and wearable devices to help track your glucose meters or your blood pressure. And we are also exploring virtual physical therapy to meet you where you are, to give you that benefit in the comfort of your own home. Support tools remain important as you rarely get enough time to spend with your provider or with your doctors. So those virtual decision support tools are very, very important, as of course are the continuing wellness tools that we offer. COVID didn't necessarily change the way healthcare is delivered. We've been looking at these benefits for a long time, but COVID certainly accelerated the delivery of those services. Our focus, however, has always been and needs to continue to be on personal support. Any intervention that we have and those support programs that we offer needs to be correct, needs to be right for you as an individual patient. And we look at all of our programs to make sure that we are meeting your individual needs. One of the things I want to highlight is that In Touch Care program that we offer, where you have the ability to actually talk to a nurse that is assigned to you and who will remain with you as long as you need that support. It is a one-on-one continuous support program. In addition, our social work program will connect you with local resources like even home delivery meal services where it's needed. Our compassionate care program will offer support for those facing advanced illness or imminent end of life decisions. It is tough, I know. And having somebody who understands that could be vitally important to you. And our pain management program continues to help and support you when you are facing chronic pain or even opioid dependency. And as I stated before, we always are exploring other treatment modalities that don't include opioid use. For 2021, we are very excited to report on some changes in your Foreign Service Benefit Plan. Now, one thing that hasn't changed is the deductible. We have not changed this deductible for several years, and we did not have to in 2021. Don't plan to in the near future as well. It remains at $300 per person, up to that maximum of $600 for family for in-network care here in the States and overseas care. We did get OPM's permission to add that all-important telemed visit in addition to our teledoc and telehealth visits. The telemed visit, we got permission from OPM, and that is payable as a normal in-person visit now. So we were very pleased to continue to offer that. I talked about our coverage of observation care, and we are able now to cover any observation care over 24 hours at the inpatient rate as opposed to the lower medical rate. We were also very pleased and excited to increase our visit limit for chiropractic, acupuncture, and that very popular massage therapy benefit to 50 visits per calendar year. And we are very excited to launch our virtual physical therapy option through our new partners at Hinge Health. And this is through our pain management program. This is just coming off the rails now, and we are looking forward to announcing this very soon. You should plan on receiving information about that within the next month or so. As always, wellness remains very important, and we have taken the opportunity to improve and enhance our Simple Steps to Living Well Together program, a little redesign in 2021. It is important to help you on your health journey, and we are making it easier for you to receive the rewards and expand our rewards to even include this year rewards for receiving your breast cancer screening, your cervical cancer screening, even getting your flu shot will result in a reward for you. The maximum reward for 2021 continues to be $400, but it's $400 that will help with your out-of-pocket expenses for your medical and healthcare expenses. Bringing things into the community is important to us, and the CVS Health Hubs brings your health journey into the community with community resources. CVS pharmacy locations are changing, and they will function as a community-based health hub. This is a place where you can get your patients' questions answered. They will help you manage your health. Many of them are staffed with a dietitian on duty and also a durable medical equipment specialist to help you learn how to use your durable medical equipment. They even offer educational and fitness classes, even Zumba and yoga classes in some areas. And of course, they provide prescriptions. CVS plans to open up 1,500 health hubs in different locations by the end of 2021. And we are so excited about this. We will keep members updated on the openings in your individual areas. Once again, bringing healthcare closer to you. Before I move on to the ancillary programs, I do want to briefly go through just a few tidbits for you, a little reminder. For example, if you are on a maintenance medication, you can now pick up your 90-day maintenance medications at either Walgreens or CVS or certain independent pharmacies if you do not want to use our home delivery option. And you can find out where they are at the website on the screen. For those of you who are taking advantage of our massage therapy, those claims do not require a CPT code, but they do have special filing requirements. So please go on our website and look for those. For those of you who have Medicare and go to a chiropractor, just a reminder that those chiropractic claims must be submitted to Medicare first because they do have limited chiropractic benefits and we do coordinate benefits with Medicare. Our electronic funds transfer feature we've made it very much easier for you to enroll in the EFT. It makes it easier for you to get and faster to get your claims reimbursement. We have now provided a fillable form that you can fill online. And for information about that, please go to that website on your screen. I also want to remind you about the HIPAA 3 form. Now, if you at any time think you might want us to be able to speak to a family member about your claims, even your spouse, we are required to have this form on file so that we can talk to whoever you choose, your loved one, your sister, your brother, your spouse, your spouse, your child, whatever. Please fill out that form, and you can get that form on the website provided at the bottom of that box. And one last reminder about our member satisfaction and experience survey. This is, you are randomly chosen. OPM requires the survey be sent out every single year. If you get it, I ask that you please complete it and return it to OPM and to us, because it is very, very important. We do look at this. OPM looks at us at it, and it does provide us a way to continue and to even improve our service to you. So I do ask that if you get that satisfaction survey, please complete it. We do want to know how you're doing. I do want to remind everybody that AFSPA does offer some ancillary programs. I'm not going to go through all of this, but we do try to make our programs and offerings as diverse as your needs are. Different life plans, different dental plans, including one specifically for overseas, disability plans, financial planning, and even tax consultant services, which is very, very important right now, especially with all of the new acts and laws coming out. So look at our website and see if there's anything that you might be interested in and might help you. A couple of other programs that I want to highlight is our discount programs. Now, these programs were created for the what if. It is kind of like a bridge between actually paying for full insurance and having no protection at all. It's for those, well, what if I get a crown? What if I need this? These are not insurance policies, but they do offer some cost savings when you need it. Of particular popularity is the True Hearing programs. Members especially like this program because you can combine the savings offered with this program with your Foreign Service Benefit Plan hearing aid benefits. That, by the way, is $4,000 per person for every 3 years. And we lowered that time so that you can take advantage of the new technology. So between the Foreign Service Benefit Plan and your True Hearing, you can really get very, very good hearing aids at discounted rates. You may want to check that out as well. And my second most popular and favorite topic is the Senior Living Foundation of the American Foreign Service. We strive to take care of our own, and this is our charitable arm to support our Foreign Service colleagues who are encountering challenges as they face aging. Our resource center provides guidance and information. Our grant support provides care management, support for medical and prescription needs, durable medical equipment, and basic living expenses for those who meet the needs criteria. And our new parent program provides guidance and help to our active duty Foreign Service personnel who are managing a parent's care from far away. You all may understand the frustration that is felt when you are halfway around the world and your parent needs you. So we are here to help with that as well. Thank you, thank you, thank you. We received over $331,000 in donations last year. You know who you are if you are on this call now. You did not let last year's economic challenges stand in the way of your support and your confidence in our mission, and we are forever grateful for that support. We were actually able to exceed over $750,000 in our grant giving last year, and we are very pleased and humbled by the way we were able to help our elderly colleagues deal with life's changes. To learn more about the Senior Living Foundation, please go to that website. It is a separate website, and learn about the work of the foundation. A couple of, just a few more things that I want to go over. You may have heard about the Consolidated Appropriations Act, and this is where it pertains to no surprise billing. We have looked at this for years, and Congress finally has looked at this and came up with this, and it was part of the Appropriations Act. This No Surprises Act protects patients against surprise balance billing in 3 scenarios: emergency services, ancillary services at an in-network facility, meaning those anesthesia, pathologists, radiologists, that type, and air ambulance services. Now, a reminder that the Foreign Service Benefit Plan has provided protections for years on this through our ERAP program, and then later our hairpin program, and most recently our National Advantage program. Your explanation of benefits will contain the full statement as to how we handle these ancillary services by doctors who are not part of the network when you are in an in-network facility. If your provider tries to bill you for any liability above that is shown, please contact us. We will deal with them. And last but not least is Medicare. There's really been no big changes in Medicare in 2021. Obviously, and the decision to enroll in Medicare Part B remains very personal. If you have Medicare Part B and your FEHB plan, you are essentially virtually 100% covered, depending on what doctor you go to. If you decide to go without Medicare Part B, you still have great coverage through your Foreign Service Benefit Plan or any other FEHB plan. If you do not have the Foreign Service Benefit Plan, it's great to be a Fed. You are able to keep that great coverage into retirement with you. I do want to caution you, as I always do, to watch out for those private contract providers. They work a bit differently. They don't work at all with Medicare, and we have to handle them differently as far as, and that is in accordance with the regulations. I will say that Part C plans, those Medicare Advantage plans, are increasing in popularity. You may want to look at that, and you can suspend. It's one of the very few times that a retiree that can suspend your FEHB coverage if you enter into a Medicare Advantage plan. But if you do enter into a Medicare Advantage plan, that is the plan you will have for the entire year. For more information about Medicare, please, I have a video that is on our website that you can watch, and you can also go to our website and get the brochure, Medicare and the Foreign Service Benefit Plan. Now, this is a complicated subject, and there are lots of ins and outs, and there are lots of questions. For those of you who ask those specific questions on the RSVP, as Kyle mentioned, we will reach out to you personally and provide you with some specific answers. But I did not want to take away from the very, very important and exciting keynote address that we have been looking forward to, and I hope that you will enjoy it as much as we will. So with that, Kyle, can you take it back?
Yes, Paula, thank you. Thank you very much. And I'll also note that the Medicare information is available on the resource page for today. So that's all in one place, multiple places also, depending on where you are on our website. But as Paula said, I don't want to delay either. Getting to our keynote address today, and our speaker is Dr. Charles Rosenfarb. For those of you who don't know Dr. Rosenfarb, he retired last fall from his position as Special Coordinator and Director of the Coronavirus Global Response Coordination Unit at the Department of State. He previously served as Medical Director of the Bureau of Medical Services, with earlier postings in Sanaa, Abidjan, Pretoria, Johannesburg, and Washington. Dr. Rosenfarb is a board-certified family practitioner and has a certificate of added qualifications in geriatrics. He completed his undergraduate studies at the Johns Hopkins University, majoring in the history of science, and received his medical degree at the New Jersey Medical School. Dr. Rosenfarb then went on to do his residency in family medicine at the University of Maryland School of Medicine, where he was later appointed assistant professor. Prior to joining the Department of State, he worked at a community medical center in downtown Baltimore, providing care to elderly inner-city patients. He has also served as Associate Director of the Geriatric Rehabilitation Unit at Kernan Hospital. Currently, Dr. Rosenfarb serves on the boards of both AFSPA and the Senior Living Foundation. Both organizations benefit from his extensive experience and his wide breadth of knowledge. And we all get to benefit from that today with his talk on mental wellness and the pandemic. Dr. Rosenfarb?
Thank you, Kyle. It's a pleasure being here today and an honor being here with colleagues. I wish we'd all be together in person, but obviously that can't be done right now. The advantage, I guess, is that we get to see and present to more colleagues than we normally would. And for speakers, also advantage that you don't see people falling asleep in the front row of your talk. Anyway, when Paula called me and said, Chuck, would you speak on mental wellness? Of course, I said yes right away because, frankly, you just don't say no to Paula. And that's one reason for that is Paula will never say no to anything anyone asks her. She's a wonderful person. But I got off the phone and said to myself, so I'm speaking of mental wellness. What exactly is mental wellness? It's the kind of thing that you know it when you see it. And selfishly, do I have mental wellness? And like any good PowerPoint presentation speaker, I looked online, what is the definition of mental wellness? And I found some fancy stuff from WHO that was very complicated. But also, I think it's best to simply just think of mental wellness as, being able to judge life positively and feeling good about life and satisfaction with your life. And for those who are equation-minded, a situation where you have your positive attitudes, contentment and happiness outweighing any negative emotions you have, such as anxiety and depression. So when you think about mental wellness in this past year in the pandemic, pandemics really are kind of like the mortal enemy of mental wellness. It's been so hard to sort of stay mentally well during this past year. So what I hope to do today is to kind of try and get across how we can be better equipped to handle mental wellness, handle the pandemic and win the battle, and better understand the impact so far of the COVID-19 pandemic has had upon all of us. Next slide, please. Okay. I do want to do a couple polling questions during the course of the presentation, just to really get a sense of where we are. Responding to the polling questions is totally optional and will be totally anonymous. But if you could really respond, that would be helpful, I think, to the group to understand. So we have the first question, please. As Paula mentioned, the plan has had 1,700 people that they know had COVID-19. I just want to get a sense on this call. We have about 180 people or so. How many folks we have on the call who haven't been diagnosed or have not suffered from COVID-19. I'm going to give people about 20 seconds and then we'll post the results. Okay. We've had so many cases in the US and overseas. We've done a lot, I think, to protect people, but certainly we've all been at risk if you've been overseas. So with the results. Okay. So a pretty healthy group. 97% feel like not been infected, which is, kind of what we'd expect. This is a very educated group and a group that I think is well aware of how to protect themselves. Next slide. It's been quite a year, hasn't it? Really more than a year now. I think the first case was discovered back in December of 2018 now, sorry, 2019. It's been over a year. And I think it's amazing when you think back that we don't really know for sure how it all started, but we suspect it was one bat transmitting the virus to one pangolin, who then transmitted the virus to one human being. And now here we are, more than a year later, we've got 114 million cases worldwide with 2.5 million deaths. In the US alone, 28.7 million cases and 514,000 deaths, all starting with one person. Next slide. We like to think this has really been an unprecedented event. And really the thing that's been most unprecedented is really the use of the word unprecedented to describe what's gone on this past year. The picture you're looking at is a picture of a scene from 1918, the pandemic, some people call the Spanish flu pandemic. That time it was estimated 50 to 100 million people died, were infected, and 675,000 people in the US alone died. But even with, there've been more pandemics in our own lifetimes. Back in 1957, there was an Asian flu pandemic and swine flu back in 2009 that killed 12,600 people. So pandemics really aren't unprecedented. Next slide, please. But COVID-19, I think we all can agree, at least everyone in everyone's lifetime on the call, has been a really unique experience. If we talk about 100-year floods or 100-year storms, I think COVID-19 really we can think of as the 100-year pandemic. When I think about it, when I think about this past year, to me, it's really been a relentless assault. People have been, I don't think if there's been one day I haven't thought about that pandemic, and I'm sure people on the phone or on the call the same way. It's just been such a big part of our lives. And when I thought about this past year, this relentless aspect of it, I kept thinking in my mind, visualizing a scene from a show that was on the US for quite some time and very popular. So we have the next slide. And next slide. Okay, thank you. So for those who really have been kind of living in maybe on the moon for the last few years, that was a scene from a program called Game of Thrones. And I think it just really emphasizes the relentless nature of what's gone on this last year. The pandemic has been an incredible assault on our lives, our livelihoods, our ability to do our jobs. And I'm sorry, I had a little technical problem on my end, but give me 1 second. And our physical health and our mental wellness as well. And you know, the enemy has not used clubs and spears to go after it like they did Jon Snow, but it's really used. Next slide, please. I think it's an issue of that our mental wellness has been under constant threat and a constant attack from, I think, what I might call the 5 horsemen of the apocalypse: isolation, loneliness, sadness, grief, and despair. And I don't think there are many people, after a year and a half of the pandemic, have not experienced one or most of these feelings and symptoms. Now going back to what WHO has said about wellness, wellness is kind of the ability to realize your own abilities, to cope with life stressors, to work productively, and make contributions to your community. And it's hard to do that when our mental wellness has been affected the way it has. Next slide, please. So when we face all these different challenges, I think many of us end up feeling blue or feeling a bit sad. And, that's a normal reaction. But what that leaves us with is the very real risk of developing a mood disorder. Feeling blue, feeling sad may be normal, but if it persists for too long, you may be developing what's called a mood disorder. And remember, mood disorders is a whole spectrum of them, from feeling sad, feeling blue, to something we call dysthymia, to a major depression. Next slide, please. So just a word about dysthymia. Thymia means mood, so this is kind of abnormal mood. I think of it as a precursor to depression. Certainly it's less severe, but it does persist, and feelings of sadness and feelings of feeling depressed, can last up to 2 years. But the important point is, if you don't deal with it, if you don't take care of it, it can certainly progress to major depression if you don't treat it. Next slide. So how about depression? When I was in med school, I think the first thing I learned about depression was it instills a sense of helpless hopelessness, feeling almost that you're in a pit, you're in a hole, and you just can't get out no matter what you do. And some of the symptoms associated with depression, people talk about having decreased energy, trouble sleeping, they feel angry all the time, they've lost interest in doing any of their usual activities. And there's some physical symptoms and signs as well. I mean, weight changes are a classic sign of depression, both losing weight and gaining weight. And people truly withdraw. And maybe people who were friends who you don't see very much, and you need to have concerns. What's going on with that person? Are they starting to withdraw because they're feeling more and more depressed? And of course, people who are really depressed and depressed for some time, almost inevitably or can have thoughts of death and suicide. Next slide. But mood disorders haven't been the only issue in the last year or so under the COVID-19 pandemic. There's been a disruption in daily life that really seems to especially hit hard those people who have substance use disorders. And I think we're all aware of the tremendous opioid epidemic that's been going on in the US for quite some time now. And a recent study in JAMA Psychiatry demonstrated that between March and October of 2020, this past year, ER visits for drug overdoses increased by 45% compared with the year before. And just for opioid overdoses, that's all overdoses. Opioid overdoses increased by 29%. So the pandemic has not only caused issues with COVID-related symptoms and disease, but ancillary problems as well. Next slide. And there have been other consequences. Substance abuse has increased in general, and problems with substance use has definitely increased. And why is that? Well, we're on a virtual setting with this call. Support group meetings have been suspended. There are fewer Alcoholics Anonymous meetings being held. So I think our support systems have kind of broken down to some extent. And other mental health conditions compensated because people don't have a chance to sort of get to see their providers as much as they normally would. It's been interesting data and statistics about child abuse and neglect and suicide. Initially in the first few months of the pandemic, those numbers actually went down. There were fewer reports of child abuse and neglect. But the interesting thing with that is that even though there were fewer numbers reported, the number of hospitalizations that occurred as a result of child abuse actually stayed steady from the year prior. So we think people did not go to the ER as much, but the ones that did, indicate they really had serious instances of serious child abuse. And suicide, the numbers on suicide, some people might think that it might have gone up initially because the pandemic, was something new last spring. The numbers actually went down initially, and it's kind of a situation where people kind of pull together and get strong initially, but then as time goes on, it becomes tougher and tougher to deal with. And what's really concerning, the numbers are trending up for sure, especially in teens and adolescents. And recent studies have shown that the percentage of young adults and those people between 18 and 24 who seriously considered suicide in the past 30 days has increased from 10% to 25% in the last 2 years. And that's a huge increase. And that's the people who are really vulnerable and the people who matter to a lot of us, our kids and our younger, friends and family members. Suicide attempts have increased in all ages, from 4% to 11%. But as I said, it's really been dramatic in the adolescent group, in the young adult group. Next slide, please. So that kind of leads into our next polling question. I'm not going to ask about suicide, but I just want to get a snapshot of how we are all doing, weathering the storm mentally of this terrible pandemic, and get a sense of how our unique population has coped. We are a unique population overseas, how we've coped with the mental strains of the past year. So if we can see the second polling question. Again, this is completely anonymous. We don't even know who's answering which question. But again, I just wanted to see how folks are doing and maybe compare it to the country as a whole. The good thing about the Foreign Service, and I suspect most of the folks in the call are Foreign Service people, is that we are used to dealing with a lot of problems, and we are used to hunkering down. And so I suspect that we probably are doing better than the country as a whole, but let's see the results. Okay. So it looks like, fortunately, we don't have that many people feeling very depressed. A number of people feeling anxious and stressed. Looks like substance use has not increased that much, and people seem to be weathering the storm pretty well. Next slide. So let's look at the numbers of the U.S. as a whole, and this is from a survey way back in late June of this past year. And you can see at that time, 31% of Americans reported anxiety, depression symptoms. You can see the other numbers, and it was 11% in suicide. And you might say, well, this was way back in June. What about now? And I don't have a slide to show that, but I was able to check with CDC's website. And the most recent 7-day period, the numbers are remarkably the same. If you look at a graph of how many people reported over the previous 7 days, mental stress symptoms, it hasn't changed. I mean, the last 7 days from today, 27.8% of people reported some degree of anxiety, depression. So it's been remarkably consistent, which can be a good sign that we're handling it well, but also concerning that, it hasn't gotten any better either. Next slide, please. So, some interesting questions I think can be asked. Number one, does COVID itself cause mental illness or cause mental problems? You know, we know that I think trying to deal with the pandemic or the change in our lives can result in some issues, but how about the people who actually contract COVID? You know, do they have higher rates of mental illness? And there was an interesting study published in Lancet back in this past November. And what they did is they analyzed data from 69 million patients through various patient databases, and then looked at the 62,000 cases of COVID that were in that group. And in that group, 20%, 1 out of 5 COVID patients were subsequently diagnosed with some degree of mental illness, some new diagnosis of mental illness in the subsequent 90 days. And that usually is anxiety, depression, or insomnia. And that rate was twice as high as the rate of new diagnosis of mental illness, mental issues in non-COVID patients in the same period. They also found a higher risk of dementia, which I'll talk about more in the subsequent slides. Next, please. Okay, well, and that actually also raises another question. Is this bidirectional? Is there something about having mental illness or mental health issues that increases your COVID risk? So the same Lancet study looked at that question, and what it saw is that it is indeed a situation where if you have a mental illness such as depression, schizophrenia, something, you're 65% more likely to contract COVID. And then they looked at dementia, and people with dementia, especially concerning, because they not only had a high risk of becoming infected, they had a high risk of developing serious disease. You know, why is that? You know, certainly you can say that, well, people who are demented, you know, are less able to protect themselves. They're less likely to wear masks, less likely to do the things that, you know, necessary to weather the storm. But there may be other reasons as well, which I'll discuss more. Next slide. So recently, very recently, just a few weeks back, Newsweek had this as their front cover. COVID, what they call the COVID brain. And a lot of it is based on the fact that we're realizing that COVID is not just strictly a respiratory virus. 2 studies from China and France show that between 1/3 and 2/3 of COVID patients develop neurologic symptoms sometime in the course of their disease or after that. So more and more attention is being paid to the neurologic effects, both acutely and in the 10% of cases that we now call long haulers, the folks that just don't recover in a normal amount, what we think it should be a normal amount of time. Next slide. So COVID brain, I mean, that kind of fits into the whole mental wellness and concept of, you know, what can we do to protect ourselves mentally and hopefully cognitively down the road. So it's clear, I think at this point, that COVID-19 affects the brain. And I think there were hints early on, you know, one of the cardinal symptoms is the loss of smell and taste. You know, some people thought, well, that must be a direct effect. You know, the COVID enters the nasal mucosa and can affect the ability to smell, but that's not really the cause of it. You know, we feel now that there's a direct effect on something called the olfactory bulb, you know, part of the brain that basically controls your ability to sense smell and to identify smells. And that actually, that olfactory bulb is close to another part of the brain called the amygdala. And the amygdala is kind of your emotional center in your brain. And what we've seen in some COVID patients, and people described it very vividly, is, you know, an emotional detachment, that they basically just stop caring about things. And you have discussions of mothers who stop caring about their kids after they've had a COVID case. We've also been reports about people who had psychotic breaks, talk about, you know, tremors, extreme fatigue, to the point where they can be maybe classified as having chronic fatigue syndrome. And also what's been known as brain fog or profound confusion. So why is this? You know, what's causing all this? And it's not totally yet known why COVID-19 has such an effect on the brain. Some people have postulated, you know, is it a direct infection? Does COVID-19 get into the brain? Does it somehow bypass the blood-brain barrier that, you know, hopefully should protect the brain? And when it gets infected, one thing they do know is that COVID-infected cells seem to suck the oxygen out of nearby cells. So it could cause a more widespread effect than we normally would think would happen by just having a number of infected cells in the brain. It's also been postulated that this is kind of an autoimmune reaction, that basically once COVID-19 affects your body, you know, a reaction occurs where part of your body's immune system turns on itself. Something you see like in various autoimmune disorders, such as Sjogren's disease or lupus. So what we're really concerned about is this increase the risk of dementia. And if the blood-brain barrier gets breached, it's possible that that could happen. And we have historical precedents. Back in 1918, that horrible Spanish flu pandemic, a number of patients had suffered from something called encephalitis lethargica, which is basically kind of a freezing or sleeping of the brain. And it was popularized in the movie Awakenings, where they showed a patient who had that. And back in 1918, 1 million people suffered from that. In the early HIV epidemic in the 80s, at the time, about a quarter of cases did show evidence of severe cognitive effects and possible dementia. So we know it's possible. We know these viruses can affect the brain, but there's still a lot to be figured out. And we'll have to follow closely those who've been affected to see if these things happen over the course of the next number of years. Next slide, please. So, this has been quite a long tunnel to go through. And, I feel like we've gone most of the way through, but we're still not out yet. So we have to figure out, how do we get through the rest of this tunnel at this point? Next slide. So how do we get through this? Well, a lot of it is not any big secret. Mask and social distancing have been pushed, maybe not from day one, it probably should have been from day one, but they've been pushed certainly more recently. And I think people, are convinced that mask and social distancing make a big difference. I do want to also talk about something called mediators, what I call mediators and mitigators, and then just to end on a brief word about vaccines. Next slide. So I'm not going to talk about masks. There's a lot of stuff in the media, and I think people are pretty familiar with masks at this point, and doesn't really relate necessarily to mental wellness. But how about social distancing? And we know that works. We know that, you isolate yourself, you're not going to be exposed to the virus, you're not going to get COVID-19, and your mental wellness will stay. Actually, there's a cost to social distancing, and for many, social distancing has not just been, changing your life a little bit. It's meant isolating yourself completely and even becoming lonely. And there's a real cost to loneliness. Next slide. Loneliness and social isolation have been studied long before COVID-19 came around. And we know loneliness is associated with much higher rates of depression, anxiety, and even suicide. And that's kind of borne out in what we've described amongst COVID patients and amongst population in general over the past year. And social isolation and loneliness is associated with a higher risk of dementia, which also we're seeing, and we hopefully will not be as bad as some experts think it might be. But what I think most of us may not realize is how much loneliness is a factor in some really serious physical issues. Take cardiac disease for one. Loneliness amongst heart failure patients, people with existing cardiac disease, it results in 4 times increase rate of death. People who are lonely die 4 times more than people who are not lonely, those people who suffer from cardiac disease. But also there's a higher risk of developing cardiac disease if you're really socially isolated. Studies in the past have shown a 29% increased risk of developing heart disease, and also a 30% risk of developing having a stroke in people who describe themselves or noted to be lonely and totally socially isolated. And the bottom line, when you look at it also, is that in terms of death, the ultimate risk factor, or the ultimate sort of endpoint, is that social isolation is significantly increased with a person's risk of premature death from all causes. And not only is loneliness a major risk factor for premature deaths, it rivals smoking, obesity, and physical inactivity as a risk factor. So yes, social isolation was a necessary component of how we got through this past year and how we get through the rest of the next period of time before COVID-19 disappears into our rearview mirrors, but there are costs that we need to be attentive to. So that leads to mediators and mitigators. How do we mitigate some of the issues associated with social distancing? And we can really benefit by acting on some of those mediators. And the things you have to do to sort of counteract some of the medicine that you're going to have to take. And I use an analogy about arthritis drugs. They're great arthritis drugs like NSAIDs, Motrin, Selects, all these things that basically will take care of your arthritis, but at the same time will damage your stomach. So sometimes you have to take a second medication to protect you from the first medication. And what are the mediators and mitigators? So it's always good to be prepared in advance, to start out from a good, strong place. And we know from this past year that people have done best of all are those who did that, those who had adequate financial resources, because like with anything, having some money will get you through a situation much better than if you don't have any money. And also having a support system, those who were alone to begin with, who were isolated, really haven't done as well. So we build up a support system, whether it's family, whether it's friends, whether it's community-based programs, really has benefited. And starting off from a point where you have good physical and psychological health is also crucial. And remember, it's not too late to work on those things. Physical activity is crucial to sort of maintain both your physical health, but also to relieve any psychological stress you're feeling. Finally, mental resilience has been an excellent, or can be an excellent mitigator of the challenges of being socially isolated. But what is resiliency? Succinctly, it's toughness. If you can maintain this resilient, toughness about you, you can get through many challenges. And really, resiliency is the capacity to recover quickly from difficulties. And again, I don't think there's one person amongst us who hasn't had some challenges that in the last year, that required some effort, some bit of resiliency. Again, whether it's job related, whether it's family issues, whether you know someone who might have been infected, or whether you yourself have been infected. Next slide. So how do you build resilience? I think, and it's not just me thinking, I think it's been definitely documented that connections build resilience. I was interested, just a few days ago, there were the Golden Globe Awards were on TV, and Norman Lear, famous producer, received a special award. And I saw a quote, or listened to a quote that he had. The guy's 99 years old. And what he said was, quote, "I have never lived alone. I have never laughed alone. That has as much to do with my being here today as anything else I know," unquote. This is a guy who basically said he wanted to stay connected all his life. And, again, it's an anecdote, but connections not only build resilience, connections, I think, build longevity, and they protect your mental wellness. And, what's a connection? It's different for everyone. Some people, a phone call is a connection. For other people, getting a roommate. There are different ways that we've stayed connected during this challenging year in the past that we've all gone through this past year. Next slide. Okay, leads us to our third polling question, our last polling question. And this relates to vaccines. I mean, again, I'm not going to be talking much about vaccine, but I just wanted to get a snapshot of where we are with vaccines in this small sample of Foreign Service Benefit Plan patients. So if we have the poll, please. Again, we're just going to see about where we are in terms of getting vaccinated. I myself was very fortunate to have my first vaccine about actually 28 days ago exactly. And when I get off this presentation today, I have an appointment to get my second shot. I feel very, very fortunate. I know there have been some issues with getting the vaccine overseas for the Foreign Service folks who are serving in missions. Well, I think that they're getting through that pretty quickly. So we have the results. Okay. Well, it's great news to hear that almost 70%, 65% of people on the call have been vaccinated, and that most people plan to do so, and that there are very few people who are either vaccine deniers or afraid of the vaccine. Next slide, please. It's been a struggle, I think, amongst doctors and I think in general, public health experts, to try and sort of overcome some resistance in getting a vaccination. And there were a lot of vaccine deniers, a lot of concern that, am I going to be damaged by this? Is it going to be effective? And I think we've overcome much of that, and it's been slow. But I think with 82 million vaccinations being done in the US, I think people are starting to realize that this is a safe process. And it's something that certainly works, and numbers have come down in terms of number of cases of COVID in the US. There are now 3 different vaccines available. There's some discussion whether this third one, the Johnson & Johnson vaccine, may not be as effective. And some people might say, well, let's hold out for either the Pfizer vaccine or the Moderna vaccine because they're more effective. But again, the key point, I think the public health people are doing a fairly good job trying to get this across, is that all 3 vaccines protect against serious illness and serious consequences. All of them do. Maybe the Johnson & Johnson, you may see more cases of actually getting mild COVID, but in terms of preventing the thing we're really worried about, and that's serious illness, serious disease, death, or hospitalization, they all work incredibly well. And somewhat analogous to flu shots. A flu shot isn't 100% effective. Some years it's 50% effective. But even in those people that it doesn't fully prevent the flu vaccine does mitigate the severity of the illness. And that's important to remember. Next slide. So let's wrap things up. Again, I said at the beginning, to me, this has felt like a battle between COVID and between preserving our mental wellness. And there are a number of ways we can do. We remain physically active, stay connected to others, and really important, I think, from a physician's perspective, is to be vigilant for signs of depression. Monitor your mood closely. Ask your own family how they think you're doing, because sometimes we don't see it, but our family sees it. See your healthcare provider, virtually if necessary. And hopefully that healthcare provider will check in with you about your mental state. And should issues arise, or he or she identify a problem, or your family identify a problem, there is help. The first step is to seek assistance. And remember, there is no shame in this. There's, the days of stigma for mental illness or mental problems or not being able to cope are over. We all can agree that this has been an incredible year. And if anything good has come out of it, it's the fact that I think we've identified that it has been a challenge, and we all need help sometimes to get through this. And I think in some ways it's diminished the stigma of not being able to cope and not being strong. And of course, finally, get that vaccine, because the best way to win the battle is to not get infected at all and to end this pandemic as quick as possible. Next slide. There's just a slide of some programs. Paula mentioned it. There are a number of programs that the Foreign Service Benefit Plan offers to help not only with your physical health, but your mental wellness and well-being. I think Kyle will be talking more about these at the end of the session in the presentation. And with that, I thank you for your attention. It's always a pleasure even to speak with you virtually, and hopefully we'll get to see each other again in person. And I understand there may be a couple of questions if we have time.
Yes, I think we do have a few minutes, Dr. Rosenfarb. Thank you very much. And if you're running short on time, we don't want to delay you from getting your vaccine. But I do want to say that having this discussion about mental health and mental wellness is so important. And you mentioned yourself to removing any remaining stigma around seeking treatment or seeking support. So thank you very much for delving into this subject, and in particular how it relates to the pandemic that we're still in the midst of. Some of the questions have come from our members in a general way, and some are those that I've come up with after listening to you. But to step a little bit outside of the area of mental wellness specifically, you touched on this, that the health risk of social isolation can include cardiac disease, stroke, and even premature death. So speaking as a family practitioner, do you have any suggestions of how we should talk to our primary care providers? Hopefully we have a PCP relationship, but may not have a mental wellness provider relationship just yet, but how should we talk to our primary care providers about physical changes and mental wellness changes that affect each of us?
Well, the first thing, Kyle, is actually to make sure you talk to them. And I think it's been a challenge to actually see your provider in this last year. I know I've probably missed a couple of appointments or didn't attend to some issues that I had because I just didn't want to get out until safe. I think over time that's going to obviously improve. But it's important always to be honest with your provider. If you have any issues, if you have cardiac wise, if you've noticed in the last year that you've had kind of a little more shortness of breath than usual, or you've had some nagging discomfort in your chest, mention it, say something. Because if you don't say something, your provider cannot help you. So it's critical to do that. And if you have to do it virtually still, don't be afraid to do that. And virtual discussions will help as well, and will key your provider into knowing, how to direct some testing that you may have to go for, may be able to go for that in a protected way.
Excellent. I can say from personal experience, I went through that last summer, had a virtual visit. Doctor was concerned enough about what he heard that we had an in-person visit, and I am very glad that I did, given the results of some of those tests. But speaking of virtual visits, the Foreign Service, as a medical officer in the Foreign Service, I think you and your colleagues were sort of revolutionary in piloting some of the virtual visits that now all of us are becoming used to. Do you have any recommendations for ways to interact with providers in a virtual setting? Anything in particular that we should share with them that may not come across in the virtual setting?
Yeah. Well, virtual settings are really interesting. I think more and more people are realizing that this could be the future of medicine. And I'm glad to see that the program, the plan is promoting telehealth, because there's so much you can do over a virtual visit. In some ways, you can do even more, because what I found in a few virtual visits I have is that it forces the practitioner actually to pay more attention to you, as opposed to sitting there and entering stuff into an electronic medical record when they're talking to you. Again, it's all about honesty, about openness. If you don't describe to your practitioner what's going on with you, they can't help you. But there is so much. I mean, especially mental health. Mental health is so suited to a telehealth experience. And I think in some ways it makes the patient more comfortable, because the patient is doing it from a place of comfort. They're sitting in their own bedroom, living room, whatever, as opposed to sort of, facing the doctor's white coat in a cold examination room. So I think, once you get used to it, it actually is an incredibly valuable medical tool. It doesn't substitute for, like you said, an in-person visit in situations. Obviously you can't do a physical exam, but so much, we're taught in medicine, in medical school, that 80% of the diagnosis is history, non-examination. So there's so much your provider can do if you just take the time to talk to them about it.
Excellent. And just one last question, a topic that you touched on that's important to so many of us, and I know that both of us are parents of younger children, in fact, parents of twins, both of us. Do you have any recommendations for those who are taking care of their children or grandchildren, how to help the kids cope? I know there's been studies out there that there is evidence of suicide ideation in kids as young as 5. What steps have you and your family been taking? What would you recommend the rest of us do?
Well, that's an excellent question, Kyle. And it's something I know worries a lot of parents, certainly, and public health people and politicians, everyone. What's going to happen to this, COVID generation that grows up? Are they going to suffer long-term effects from, spending a year and a half in isolation and, maybe not going to school, or going to school once or twice a week physically and participating virtually other ways? It's hard to make it's a real heterogeneous group. I think with the really young, who perhaps don't remember or don't even know a period without COVID, I don't think it's going to be an issue, to be honest with you. I think, as long as the parent pays close attention and spends time and doesn't just plant their kid in front of a TV screen, I think they're going to do fine. It's the older kids, the adolescents, who are used to going to school, and used to having social interactions. They're the ones that'll be a little tougher. Paradoxically, they're also the ones that are very, very good at using social media, using virtual sessions to communicate with friends. So they do have a skill set that actually is going to help them get through this, maybe better than some adults who really are technophobic or don't connect with people virtually. But the most important thing, again, is be with your kid, spend time with your kid, be very vigilant to how your kid is doing. And I used to say in the Foreign Service, in all those years I was a member, that with kids, some kids do incredibly well in the Foreign Service, and some because they spend more time with their family than they ever would have if they'd been back in the U.S. And hopefully that's the case now. Hopefully one beneficial thing out of being forced to be isolating in your home this past year is that families get stronger, and again, that's going to be really beneficial for parents and for kids.
Excellent. Well, thank you very much, Dr. Rosenfarb. We will let you get back to your kids as well as get ready for your vaccine appointment. But thank you so much for sharing your thoughts with us today, as well as your expertise. And we will be calling upon that expertise perhaps in the future. And I can also share with those who are tuned in, we also are working with our partners at Trestle Tree to launch to promote some podcasts on how to work with teens and tweens, particularly during this time, and address their mental health needs. So thank you for your insights today, Dr. Rosenfarb.
And everyone stay well.
Thank you, sir. Our next segment are those online demos that I promised you. So we'll be looking at demonstrations of the AFSPA member portal, the Aetna Secure member website, and Express Scripts website, as well as its mobile app. And to kick us off, we have our IT manager from here at AFSPA, Yancy Meiller, who's going to walk us through the member portal that many of you probably are familiar with for submitting claims, but she's going to show us some of the other features that are available, as well as what the future of that tool looks like. Yancy?
Thank you for participating in this year's annual meeting. I will now move forward with the demo for the Secure Member Portal. The website can be accessed by going to https://myafspa.org. That is myafspa.org. Once you go to the website, you should see the page that I'm currently displaying on my screen. I will now move forward with signing in with our test account. And once you authenticate with an account, you will see on the site the current members' information. In this case, if you're a subscriber of the Foreign Service Benefit Plan, you will see right in the middle of the screen your plan information, ID, FSBP ID information, policy date, coverage, plan type. On the left-hand side, this is visible to all AFSPA members. This is the area where you can verify that we currently have up-to-date information for you. And if there's any information that's not correct, or you need to make any changes to your communication preferences, you would click on the link here where it says click to update. And as you can see, now the fields have changed. I can now go in and change the details here. I'll change the city so you can see what that looks like. Under communication preferences, you can choose to receive communication from us via mail, email, or you can choose to unsubscribe. The only exception is any required documentation that we absolutely have to send due regulation. And lastly, the option here for you to receive the actual hard copy of the plan brochure. It's not a requirement for everybody to have a hard copy, but this is where you would go in to choose to receive one. Additionally, you can always contact a health benefits officer, and they can always arrange for you to receive a hard copy of the plan brochure. Going back to the FSBP section, here you have the secure forms, the single sign-on tab, and the plan documentation. Under the secure forms, you have the option to submit a claim. You have the option to submit questions regarding claims or benefits, questions regarding ID cards or enrollments. And then you can also submit documentation directly to us for marriage, birth, death certificates, or any other documentation that's required for you to make changes to your plan. If you click under submit a claim, you see the options to submit claims without questions, claims with questions, and claims directed to a specific HBL. And when you send a claim directly to a health benefits officer, that would be in a scenario where you're currently working with a health benefits officer and there's documentation that perhaps needs to be resubmitted, or any documentation that the health benefits officer requires in order to provide further assistance. This is where you would need to go. And as you can see, the form itself is pretty straightforward. You have the option to select who the claim is being submitted for, the reason or diagnosis for the visit. In this drop down here, you would select the name of the health benefits officer that you're currently working with. And in here, you would go in to browse for the files that you wish to upload so that the health benefits officer can process the documentation. For today's demo, I will actually move forward with submitting a claim with questions. I'm going to select one of my dependents. I will select the service year 2020. Reason for visit or diagnosis will be test, since this is a test submission. I will click on Browse Files. I will select the file that I wish to submit. And I'm including a comment. Now, for claims that are submitted with comments, they go to an actual team for review, and they'll review individually the claims with comments that you are submitting. When you submit claims without questions, those get processed right away. So I will select here that I'm certifying that the information in this claim submission is complete and accurate, and I will hit submit. And as you can see at the very top, the system has confirmed that my claim has been received and combined into a single PDF, which is now available in my claims section below. So I will scroll down. So I have the dependents information here and the My Claims section here. So I will click to expand here. And as you can see, there is submission for today's date. I have the ability to download the PDF file yes, here we go. Download file and the comment that I actually entered as I was submitting that file. And the claims themselves are sorted by the year, so you can shrink the years. It all depends on how far back the enrollment goes. This is just a test account, so we have claims going back to 2018, but it's just to give you an idea of what it would look like. If you're subscribed to other plans, for instance, our test account here is subscribed to the immediate benefit plan. As you can see, there is information in regards to that enrollment. And in here, you would see the details as far as beneficiaries that would be listed under that policy. I am going to the FSBP SSO, which is the single sign-on. You have the option to go into the Aetna single sign-on. You have the option to utilize the ESI single sign-on. And under the plan documentation, you can view the benefit brochure, the benefit handbook, member rights and responsibilities, and notice of privacy practices. This covers the member portal as it is configured today. However, I would like to announce that we are currently working on developing an actual web application that will allow you to navigate the system via mobile device in a more cohesive manner. So I will now share that screen for you so you can see. Now, this is something that we're developing, and we are hoping to have it go live very soon. We're still under the development stages, but as soon as we have a go live date, we'll be very proud and happy to announce the new application and the new site. The new website will be accessible via mobile devices. You can see here. The member portal login page looks very similar to the page that we have now via the website. Once you sign in, the information will be very easy to read on your mobile device. If you're a subscriber of the Foreign Service Benefit Plan, you'll be able to see the plan information, policy date, coverage, dependent information. You'll have the option to submit claims, submit messages directly to us. And as you can see at the very top, you'll have the option to access your single sign-on for ESI and for Aetna. This is just a quick preview of what the submit claim form will look like. Again, the very same options that you will have on the web view, you'll have on the mobile app. You select the claim type, you select who the claim is for, the service date, if there's comment in case you select a claim with comments, and you enter the diagnosis and the reason for the visit. But as you can see, the very last option here in this image on the left displays the option for you to actually capture a picture of the claim. And I know that some of you have voiced and requested to have this feature, so we're happy to announce that we've worked towards that goal. And so we'll be going live once again with this very, very soon. Once you select you take the picture, the system will automatically take that picture and convert it so that we can actually process it like the rest of your claims. And once the claims are uploaded, you'll be able to see the date that the claim was uploaded. You'll be able to download that file so you can review it via your mobile device. Again, you'll be able to contact us securely, sending a message directly from the member portal directly to us. And just you'll be able to also submit other information besides claims, like marriage, birth certificates, etc. And that concludes the member portal portion of the demo. Thank you very much.
Yancy, thank you. And thank you for showing us a preview of what's in development. The request to be able to just take a picture of the claim with your phone and upload it has been something we've been hearing for years, and we're glad to be offering that in the near future. We want to make sure everything's working really well before we roll it out to members, and we have that in process right now. Yancy mentioned that there's a secure sign-on option within the portal right now that takes you to one of the options takes you to the next site that we're going to look at, which is the Aetna Secure portal. And I appreciate everybody's patience. We are sharing screens today, so there's a little bit of a transition, so thank you. And the next screen that's going to be shared is by our next presenter, Jay Dockins from Aetna. Jay is going to show us some information about the Aetna Secure member website, as well as some of the wellness tools. So I'm going to not delay any further and ask Jay to take over.
Thanks, Kyle. Just wanted to check out. Can you see my screen okay?
I can. I'm looking at the login screen.
Okay, great.
Thanks.
So once you're at the login screen, you can get to this, as Kyle mentioned, through the previous site that you just witnessed on the demo, or you can also visit Aetna.com and get to it as well. This is a test site, so you know, the features are the same. The features are the same, but some things are going to be, you know, not shown, like claims and things in the test version. I'll just give it a second to load. As Kyle mentioned, there could be a slight delay. Okay, so once you land into the site, you'll be on the homepage of the site. And the first thing that I'm going to mention is at the top here, there's a note that you can download the mobile version of this site through the Aetna Health app. You can access that through Google Play for any Android device, or the Apple App Store for any iPhone or Apple device, to get the same version of the site for all your mobile devices and tablets. Okay, so on the home page, I'm going to kind of walk you through all the key features of the site. The home page, what you'll see there, the claims area where you'll see, you know, where the claims and explanation of benefits will be, benefit overview, how you can find your providers and get cost of care. And then I'll walk you through our health and wellness section. So once you scroll down, you're first highlighted, you know, the find new care where you can find your providers, get quick care, and view all your selected providers that you have on your plan. And I'll get into more detail into that in a second. The plan overview will show you your current deductible, what you have remaining, what you've spent, your out-of-pocket maximum, what you've spent versus what's remaining. There is a feature here called What's Covered. And you click on What's Covered. It will provide a overview of all the plan summaries of all the key benefits under your plan, which is a nice feature that is on the home page of the site, as well as the top under benefits, and I'll show you that in a second. The next is the ID card button. And this will bring up a digital image of your ID card, so you can have it available whenever you need it. You can also request a physical ID card if you have lost your ID card or have not received it for any reason. And then under the spending details section, this will get into start to get into the claims area, where it will, again, highlight your in-network spending for deductible and out-of-pocket maximum versus in-network versus out-of-network. Also at the top here would show, this is where all your claims would come into. There's no claims in this, being that this is a test site, as I mentioned. And here would also show your explanation of benefit statements as well. Again, at the top, benefits section will highlight all your benefit, as I mentioned, that you can access also from the home page. Now here under the Find Care and Pricing, this is where you would find all your providers. And one of the easiest ways to find your providers is to simply click your name, a provider name, specialty, procedure, or medication right into the search bucket. And when you do that, I'm going to show you, it brings up, if you click on providers, it will take you to all the providers in your zip code, in your area, based on your information that's loaded. If you click on procedures and you click on the providers, one thing that it will do, it has now, the secure member website is now integrated with our cost of care feature, and it will show you what the estimated cost for these providers before you actually book an appointment, which is nice feature. So as you scroll down on the Find a Care section, you'll get different segment features within the Find a Care. There's a quick care, which shows you can quickly get to our MinuteClinics through CVS, any urgent care centers in your area, any walk-in clinics, emergency rooms, or even you can launch the teledoc. The provider section quickly highlights some of the popular providers that you may want to search, as well as the clinics and hospitals. You can also get your lab information in your area, as well as any other like facilities. And then the service and procedures section shows some popular services and procedures that you can also search. But again, all of these you can quickly search here at the top. So now I'm going to walk you through the health and wellness section. When you get into the health and wellness section, there's 4 main areas. Discover a Healthy You, which I'm going to show you in a second. This is where you can improve your health and well-being. It helps you to set your health goals and shows, all your reward information regarding your healthy rewards for the wellness program. Under the discounts and services, I'll click on this for a second. This is where you would learn about all the perks and discount programs that come with your plan. There's, discounts on acupuncture, massage therapy, gym memberships, LASIK, vision, weight management. So this is where you would go for those programs to learn information and find out the discounts on those programs. Also, there's a maternity support center. In the maternity support center, this is where you can go if you're planning to start a family, or if you're currently having a child. This support center will walk you through each stage of your pregnancy. And the Stay Healthy section, I'll click on this real fast before I go into Discover Health U. There's something in here called Emmy, and Emmy, it will take you kind of out of the site and launch another site. Give it a second. So Emmy is great for if you or anyone in your families currently having any type of blood problems, any type of treatments that you maybe have diagnosed with that you have to get treatment for. You can go in here and Emmy will help you provide information. You can print out information, and it will also launch videos to help you explain all the different aspects of the treatment program and the diagnosis, so you can get great information about it. And now I'm gonna take you into Discover Healthy You. And again, Discover Healthy You will be a great site for you to find out about all your wellness rewards and ways to improve your health. So when you first get into the site, on the home page here, you'll see, right at the top, it's going to take you to your FSBP wellness rewards. And you can, click on each one of these. There's the health risk assessment, information on, about getting your physical exam, and then information about completing a biometric screening. When you click on view all rewards, it will explain, the program for each one of these activities. And and also you can learn about how much each activity is worth towards your rewards. You can earn up to $400, as Paula mentioned earlier, in these wellness reward program. I'll give it a second to load. Sorry for the delay. So further down on the home page is tips and strategies on ways to improve your health. There's also tracking here where you can connect all your fitness devices to help you stay on track to, for better exercise, sleep, weight management, and also ways to help with your calorie intake. And once you connect your devices, everything will be tracked right in your rewards. So there's also digital coaching within the Discover Healthy You, and this is great for, if you want help with exercising and different activities to help improve your health as well. There's challenges and also additional resources like HealthWise, which features different health topics and health conditions, and you can learn about different medications and procedures as well. I'm gonna take you back to the home page here, and I'm gonna show you one more thing before I wrap up. And that is at the bottom of the home page here, there are quick member resources information about, your forms. You can actually get right to Discovery Healthy You section right here by clicking on the Wellbeing Resources. That will take you right to the Discover Healthy You section. There's mental health support and services. And then one last thing I want to click on is our Cancer Support Center. And in here, you can get great information for about all the different various support for the different forms of cancer for the patient, as well as the caregiver can access this information. So it will help through each stage as you are dealing with any type of cancer. So that is pretty much the demo that I want to show you today. And with that, I'll turn it back to you, Kyle.
Great, Jay, thank you so much. This is a fantastic overview of this site that offers so much to members and also gives a view of what the mobile app would look like. And I'll just point out that Discover a Healthier You, that is also where you can take your online health risk assessment and in about 20 minutes, earn some money back in your pocket through our wellness program. Without any further ado, I want to move on to our last demonstration. And this one is of the Express Scripts site, and it will be led by Abraham Hernandez, who is from Express Scripts. And Abraham, I can see your screen.
Wonderful, Kyle. Thank you so much. And just, I apologize. I think it's bandwidth. My webcam is failing, so I will continue to try to start it. But I do apologize. I know we did several dry runs to avoid this, but just a lot of folks on the session, it seems. Okay. So thank you so much, everyone, for sharing time with me. I know we've gone over so much information today, so I'll do my best as I demonstrate the capabilities of our member website and our mobile application to hone in on some of the more common features that help you maximize your pharmacy benefit. As Kyle confirmed, we are looking at my screen. This is the member website. I invite you to visit us at www.expressscripts.com, or you can type in www.esrx.com. I heard there is a single sign-on configuration on your website, so that might be another way to access the Express Scripts site. When you access the site, you obviously want to log in. Nonetheless, I want to point out some of the key features down here, guest tools. Without having to log in, you can quickly check on the status of an order, pay a bill, or refill a prescription. Those are the top reasons we know that members engage with Express Scripts online. So we put these intentionally up front to help you quickly execute what you're trying to do. Upon login, you're going to land on what's called the dashboard. And as it loads here on my end, the dashboard is truly a one-stop shop, per se, where you can request refills for yourself and your family members, check on the status of a mail order prescription en route to your home, make a payment, or perhaps set up for your privacy parameters, communication materials, whatnot. On the far right, you'll notice that savings opportunities are identified. This is the area of the website, and I will say we're obviously not looking at any kind of IHI or PHI data. This is dummy data that reflects the experience that you will have as you navigate through our site. Here, for example, you will see any kind of savings opportunities. Let's say you've obtained some prescriptions at retail, and we know that you can save money through the home delivery pharmacy. You'll see that there. If your benefit includes a 90-day retail network benefit, this on the right side will let you know what your pharmacy choices are, which pharmacies you can go to use that 90-day program. I'm going to demonstrate how easy it is to request a refill. Notice how I click the available refills tile, and on the right, the pane will zoom in and show us all of the available fills, medications, for the patient, including their dependents. The household view gives you instructions on how to view information, perhaps for an adult dependent on your account. In this example, we're looking at atorvastatin. Notice how when I click the prescription number, the additional window flies in, letting us know all the details about that script that we need to know. For example, how many refills are remaining on the prescription? When does it expire? The name of the doctor and pharmacy that dispensed the medication. About this drug, it's a hyperlink here. This will give you imagery of the medication and commonly asked Q&A. I'm going to click on Add to Cart, And notice when I do, the cart in the upper right-hand corner of my screen is consistent. It has a number 1 because we've placed one product in there. And it's consistent because the cart will follow us in any of the other screens built on this website. That way, if you navigate away from it or maybe visit our mobile app, which is the next topic I'll demonstrate, you can complete your order either to the member website or their mobile app. The cart will retain what you placed in it for 72 hours, giving you flexibility to choose whether or not how you would like to move forward. When I click Add to Cart for Lisinopril, we now have 2 scripts in the cart. Let me show you how easy it is to quickly review and submit. Before we check out, we want to make sure that what you placed in the cart is what you intended to. So we have the remove buttons here. It gives you the copay of each medication. Proceed to checkout lets us briefly confirm and verify in the upper left-hand corner here the shipping address the medication is being shipped to. You have the flexibility to change that as well, including the default payment method. I can click change and select up to 4 different credit cards that the web allows us to store on file or pay using PayPal. On the far right, we can expedite shipping, completely optional. And notice one last review. Before we submit and place the order, we have a recap of what was put in the cart as well as the remove feature to make sure, once again, that we're not sending anything out that you do not intend to. Clicking place order will generate a confirmation number, which is sent via email. Now, I will say on this demo site, although it's not obviously activated, you do at this point have the ability to chat with one of our care advocates should you have a question on the order. And should you choose to receive text messages as a communications channel with Express Scripts, we will text you when your refill has been processed and when you can expect the delivery of your refill. That was how to request a refill. Checking on the status of an order is the #1 reason why members visit us online. Recent orders appears in the middle. Very similar experience. We try to keep things similar to keep it simple. Notice Protonix has already shipped. That's the status. I can click View Details, and at the very top, I can see the progress bar of where this medication is en route to my home, as well as a tracking number that I can visually see all the stops it's made, including at the very bottom what the plan paid and what my copay was. I will say there are other features on this member website. I could literally go on and on. I just called out some of the other features here. You can look at your benefit overview to see what your copay structure is like, what your benefit is set at. Communication preferences, for example, if you want to mask any kind of individual health information on your communications. Prescription has a price of medication, a very popular feature on our mobile app, and I'll use that as our segue. What we're looking at now is the Express Scripts mobile app. Think of it as the best of features of the member web that lets you access your pharmacy benefit anywhere you are at. If I click username, we can use the exact same credentials to log into the mobile app that we do the member website. You don't need separate sets of keys. It's the same user ID and password. And depending on your smart device, the app does give us biometric face recognition login capabilities as well as fingerprint or enabled Touch ID. Once we log into the mobile app, you'll notice that the look and feel of the app is very similar to the member website. Again, for consistency purposes, reducing unnecessary confusion. When I click on recent orders, for example, you can see all the recent orders on file, where they are at in transit to your home. The More button at the very bottom gives us additional options. Price of medication is another popular option. And I will also show you the pharmacy locator. Find a pharmacy. Here it is. Find a pharmacy. Great tool on your mobile device. Let's say you're at your doctor's office, and we're commonly asked the question when leaving the doctor's office, which pharmacy would we like these scripts faxed to? You can quickly use the mobile app to launch Find a Pharmacy, use your GPS location or manually enter a zip code. And once you click search, depending on your location, whether that be your doctor's office or not, the mobile app will show all the in-network pharmacies. And I can even tap the map view. And all these blue pings that you see, these are the pharmacies closest to where we are geographically located. The same experience happens when we're pricing a medication. If I wanted to tap any of these pharmacies, these blue pings, that would launch our GPS directions and give us driving directions to get to that specific in-network pharmacy. Price of medication follows a very similar experience. I know when I'm being at the doctor being prescribed a medication, what's going through my mind is this medication covered? Is this the cheapest medication? Is there a generic? The mobile app lets us enter the name of the medication that we are being prescribed, all the available strengths that the doctor is either prescribing or wants to prescribe, and it identifies any generic alternative as well as our copay for either the traditional 90-day supply at home delivery or 90 days or 30 days at retail. Now, sometimes we may want to know what our copay is for a 10-day supply, a 5-day supply. That's absolutely okay. We can recalculate manually by entering whatever numeric value to recalculate the day supply. And once we do, we'll see on the mobile app in context, sitting there with a doctor, what the best price for that medication is. The most competitive price will appear at the top. That's the home delivery pharmacy. But we're not agnostic to any of these channels. We also honor our retail partners. So notice the best value at retail is this specific retail pharmacy. That is the best value pharmacy. And I can just scroll to the bottom and view all the other pharmacies in which that medication is in stock and I can go and use my benefit for. I've covered so much in this brief demonstration, I could literally go on and on. One last thing here, on the mobile app, and I will go to my home here, you have the ability to set what's called dose reminders, a really neat feature. Because we're on our phones so much throughout the day, we can actually use the mobile app to set reminders for as many medications that we would like. We don't want to inundate you with reminders, so we do ask for your permission to allow you to send push notifications to your phone. Once you give us that permission, then at that point, you can set up as many reminders as you'd like, including hiding the name of the medication in case you're in a public area or you just don't want folks knowing what therapy you're on. The main idea of this functionality is to ensure that you don't miss a dose and you stay adherent to therapy. Once we set our reminder, the phone will buzz or whatever setting we have configured will let us know that it is time for the next fill. Once again, as I wrap up this demonstration, I do invite everyone to visit our website, also download our app. When you download the app, although not demonstrated today in the interest of time, when you download the app, you will receive a brief tour of some of the key features of the mobile application. That way, you can learn quickly how to start leveraging and maximizing your pharmacy benefit. This concludes the demonstration of the pharmacy side. I will now hand it back to Kyle. Thank you so much, everyone.
Abraham, thank you so much. That was fantastic and a great overview. And I encourage everybody who may be taking maintenance medication, take advantage of those reminders on the mobile app. You're going to have your phone with you most of the time. This way you don't miss a dose, you don't miss a day. So thank you again, Abraham. I have just a few last points I want to touch on before we get to a few questions and answers. I mentioned at the beginning that our theme for this year is the same as last year, that mental wellness leads to better physical health. If you've attended one of our programs over the last year, you've heard Paula or me or perhaps someone else use this quote from Lena Horne, that it's not the load that breaks you down, it's the way you carry it. And we, as your health plan, if you're a Foreign Service Benefit Plan member, we are here to help you carry that load. And we talked about some of these programs today. Paula went in depth on In Touch Care. We talked a little bit about digital coaching programs and the one-on-one coaching that are available from partners. And the digital coach program is available through the Aetna Secure member website. My Strength is also available for members, and it is an online service. It's just you and the program. There's not a person on the other side, so you can go at your own pace. There are daily affirmations and other ways to walk through things like stress, anxiety, and so forth. Telehealth is available, as is telemedicine, to engage with the provider so that you're getting the care and support you need. And Able To is a program that's available right now only to our members in the United States, but it's to help you when you're going through a major life transition. And there is a person on the other side of that. They're walking you through the program. And the major life transition could be loss of a loved one, birth of a child, or welcoming someone new to the family. Could also be diagnosis of a new condition for yourself or a family member, anything that you might need help with. We've got these programs to support you to get through life. And all of this is part of becoming and continuing to be partners in your health. And we're doing that in any number of ways. On the next slide, that we've got the coaching programs that I mentioned before, the In Touch Care program, the expert support diagnosis. So when you are facing something like a cancer diagnosis, a neurological condition, you can reach out to experts at Pinnacle Care if you're in the US, or seek a second opinion through the eCleveland Clinic. Use those programs. They can really help you, get you the best advice, get you in touch with the best experts. When it comes to mental wellness, we touched on Able To and My Strength, but I encourage you to look into those. Check out our ancillary programs if you're looking to meet your dental, life, or disability needs. And accessible solutions, I can tell you as a Livongo user myself, my meter's right here, it has really changed the way that I manage my chronic condition and really improve the way my results and the way that I'm feeling. So use that. Engage in telehealth. It is very useful, telehealth and telemedicine. And that pharmacist support is there. I know that can be really crucial when you're dealing with a new diagnosis or a change in your pharmaceutical regimen. If you're using a new drug, please use that. We have these therapeutical resource centers and so forth just for your benefit. And the wellness programs are there for all of us. But if you're somebody who says, I am healthy, what have you got for me? Go and take advantage of these healthy actions. Earn those wellness rewards to lower your out-of-pocket costs, and engage in personal strategies. Find what works for you. We continue to care for your health worldwide. That's what we want to do. Let us support you. And with that, we have time for a few questions. I know we're running a little over time, but Paul, we still have over 100 people, about 120 who are with us. And looking at the names, I can see that we've got friends and members from around the world, down the street, as well as I recognize one name as far away as Austria, and I'm sure there are others. So we're not taking live questions, like I said, but I do want to start off by saying we got 150 questions, and I want to say, first of all, a thank you to our friends at the American Foreign Service Association, or AFSA, because about a dozen of the questions we received are really in their area. So we've sent them to AFSA to answer. But a question that I have for you that actually came in from several members was, what efforts is AFSPA taking to keep FSBP premiums low?
Thank you, Kyle, for that question. Actually, it's you who is keeping the premiums low. Our members are healthier than most, and our members actually embrace wellness. So we work every day to ensure that our members have access to the right care at the right time. You're great about going to the doctors and making sure that you're getting those physical exams. We are offering services like Livongo, like the one that is very popular for diabetes and blood pressure, to help manage those chronic conditions that keep you out of the costly hospitalization, and you are embracing that. We work with our prescription benefit manager, Express Scripts, to make sure that we can keep your prescription costs low. And we are constantly looking at ensuring that all of the negotiated discounts, all of the rebates that they work out with manufacturers, that savings comes back directly to the plan, and we're able to use that to keep that premium lower and stable. This is why we haven't experienced what I call those roller coaster premium raises. It is our responsibility to look ahead. We do that every year, and I'm not talking 1 year down the road. I'm talking 5 years down the road. What's our medical trend going to be? What type of medical breakthroughs are there going to be? And how is that going to affect our members? How many members? And the premium, and also look for those innovative opportunities like Livongo, like that virtual physical therapy. You know, healthcare is complex, and you rely on us to manage your health plan, and that way you can manage your health. So those are just a few examples of what we're doing to keep those premiums stable.
Excellent. And I think you answered a couple other questions that we received about Express Scripts and our relationship there, and some of the other ways that we go about initiating new programs. One of the programs that we don't have is any kind of support or reimbursement for gym membership. We had a number of members who asked about that. Why don't we pay for gym membership?
Oh man. Okay. Thanks. This is not the first time we've had this question. The basic reason is why we don't pay for gym memberships is because we can't. Believe it or not, gym memberships are not an eligible medical expense under the IRS code. And in a fee-for-service environment, which we're in the Foreign Service Benefit Plan, we can only pay for covered and eligible medical expenses. And gym memberships or things like that, things like silver sneakers or things like that, we are not allowed to have a benefit for, which is why when we partner with Aetna, we are able to provide discounts for Global Fit, Noom, the weight loss program, Garmin, Fitbit, things like that. But the short of it is we don't pay for gym memberships because we're not allowed to pay for gym memberships. It would be considered taxable income for the member.
Excellent. And taxes can be complicated enough. No need to make it more complex. I will mention that those discounts that you said, Jay showed us where those are in the Aetna Secure Member website. We also had a blog post about that back in December, and you can see that at afspa.org/blog. All right, Paul, we've had some fun exchanges about this next topic over the years, but we also had some questions about long-term care insurance. We didn't talk about it in depth today. We don't have a ton of time, but can you tell us a little bit more about long-term care insurance?
You know what? There's nothing fun about long-term care insurance. We've been offering it since 1990 for those of you who've been with us that long, but it is an important consideration for everybody. As long-term care matured, the benefit matured, we found out that one size does not fit all. And so, which is why we changed our focus and we concentrate more on providing members with the counsel that they need in order to get the long-term care policy. But make no mistake about it, long-term care insurance is vitally important to have in your portfolio. The average cost of a nursing home is anywhere between $86,000 and $100,000 a year. And there is no health plan, including the Foreign Service Benefit Plan, that covers this type of care. So it's a hard pill to swallow, pardon the pun, but it's very important to look at long-term care insurance. Federal program is a great program, federal long-term care insurance program, but it is one of many very good programs. And since the federal government does not subsidize any of the long-term care plans like it does the health plan, it only makes sense to look outside and get the best deal. And that's what we're here to do for you.
Excellent. We've got some partnerships. You can find more information on our website about that. Paula, similarly, what about disability? We got a couple questions about that. Why would our members who are still active employees want to look at a disability plan out?
Yeah. Okay. So, I've been with AFSPA for over 30 years, and this question has come up probably every 5 years or so. And for the longest time, we couldn't in good conscience offer a disability plan because I didn't feel our members needed one because of the excellent retirement and disability retirement benefits that the federal employees have. But things change, and what I've seen in changes over the last couple of decades is medical technology has changed drastically. Those conditions that were previously considered a permanent disability are now considered chronic in many cases, a chronic condition that is treatable. So while you may be out for 6 or 12 months while you deal with that, it doesn't result in permanent loss of your ability to work. So there's a couple of questions when you're dealing with disability. And should I not have it is, if you're going to be out for 6 or 12 months dealing with chemotherapy or cancer or whatever, do you have enough sick leave? A lot of our members do. They've been with the government for a very long time. They have that sick leave. So they may not need the disability. And another thing is, if you had to pay your bills without having an income for 6 months, do you have enough in savings? Many of them do. If the answer is yes to either of those two questions, then you probably don't want to look at disability. But if your answer is, well, I'm not so sure about that, then that's why you look at disability insurance, protection and peace of mind. Now, we've been offering disability insurance for several years now. We are actually able to launch a new plan that is coming out in just the next few months that has increased the monthly benefit to now up to $7,500 a month. And we've done this through our relationship with Cigna Global. Why is that important? Because they are ready to support our members in anywhere in the world, like we support our members anywhere in the world. So it is really a good match. But if you don't need it, then don't get it. But if you do need it, we've got it.
Excellent. Thank you. Paul, early in your presentation, you mentioned that the majority of our claims for related to COVID were lab tests. We talked about coverage for vaccines, but what about COVID testing? We had some questions about that. How are we covering COVID tests? Has that changed at all?
So right, COVID testing. Actually, it was a year ago today that we were together the last time at our annual meeting, and this is when we first started with the COVID testing and stuff like that. And at that time, on that day, we decided to cover COVID testing at 100%, period. And that remains the same today. And we certainly didn't need a literal act of Congress to do that for our members. So we will continue to provide benefits at 100% for COVID testing, whether it is stateside or overseas. And that will include the new home tests that are coming out that are FDA approved.
Yeah, that FDA approval is key. And we'll continue to have updates on our website about COVID coverage. You'll see a link to that's dedicated page on our homepage. Last but not least, and this is following a bit of a pattern, but we do get questions about our other non-health plan programs. We had a series of questions about dental coverage. For instance, why is the coverage so poor under FSBP? Why is it so little? You touched on some of the options earlier, but can you talk about why that's the case and if there are other options that members should be exploring?
Right. Well, so there hasn't been changes in dental benefits for any of the federal employees' health benefits plans under that program. We are no exception, and the reason is that we cannot. Back in the early 80s, they started allowing plans to put some minor dental benefits, ancillary dental, what we would call supplemental dental insurance, in, and most of the plans took advantage of that, and very limited. We were very happy that we included orthodontics in our Foreign Service benefit plan, but then OPM put a cap. There is no changing the benefits that any plan has in the 5D, which is the dental benefits category. But believe it or not, your dental treatment, your FEHB plan, whether it's Foreign Service or any of that, or Blue Cross or anything, is the plan that is primary for accidental injuries or any non-dental oral surgeries, like impacted wisdom teeth, things like that. That is covered under your health plan. What isn't covered, or covered very minorly under your health plan, is those supplemental, the normal cleanings and things like that. Foreign Service benefit plan will provide for 2 dental exams and cleanings for all of $36 each year. Don't spend it in one place, but we cannot change it. So what do? You go, if you still need dental coverage, you go to what they call supplemental dental plans. Now, the Federal Employees Dental and Vision Insurance Program has tons of excellent dental plans in that program. If you're overseas, I always caution you to make sure you know what you're buying in those dental programs, because that is considered out of network. AFSPA offers 4 separate supplemental dental plans, one specifically for overseas members. But I do caution, as I do and when I talk about this to everybody, is make sure you understand what you're getting and you do the math. Because you may be covered under whatever health plan you have. You may be in an area where dental treatment, it doesn't cost as much as it does in the United States. You may have, you may be part, if you're an active duty, have a flexible spending account where you can use that money, your money, but you get your tax break to pay for that. And then again, if you're in the US and you're not quite sure about whether you like to pay that monthly premium for dental insurance, you could use one of our dental discount programs. So there's lots of different ways to handle that. I know that dental insurance is a big thing, and the federal programs have very good, excellent dental plans, but just make sure they work for you.
Excellent. Well, thank you, Paul. I think we'll end there because we are already over time. So thank you very much for answering those questions. And as I mentioned before, anyone who submitted a question during the registration process will be receiving the response. If you haven't already, you can expect that probably over the next week or so. Any additional questions that didn't get answered today, you can send to outreach at AFSPA.org. So I want to take this opportunity to remind you that you can find AFSPA on social media. We've got a new team who's managing that on LinkedIn, YouTube, Facebook, and Instagram. Feel free to follow us on any of those or share your pictures or comments with us. But most of all, I want to say thank you for attending today. Please don't forget about our resource page in the virtual packet. You can find out more information about the programs we discussed, as well as others that we didn't have time for. We will be posting a recording of this as well as recordings of the various demos, so you don't have to scroll through it in the next 2 weeks. And we'll alert you via those social media channels. So go ahead and subscribe or follow us now, and also via email. I will say that when we end the meeting and when we close out, you will be prompted to answer a brief survey, just about 5 questions. I welcome your participation in that. It will help us improve future events, be they virtual and or in person. So please take the opportunity to do that. And I also want to take this time to say thank you to Mr. Tracy, to Dr. Rosenfarb, to Paula, to Yancy, Jay, and Abraham for sharing those demos with us, as well as to our team who's behind the scenes, particularly Nene Abenobi and Hannah Wolfhart, who've been producing this event and put in countless hours, Michelle Alfonso for making this PowerPoint look the way it does, because my skills do not reach into this area. So a true team success. And we remain here, there, and everywhere from our homes as well as in the office, supporting you, our AFSPA members. So please don't hesitate to turn to us if you need anything that we can help with. Thank you very much.